This is Dr. Amir Jamali. The title of this presentation is Femoro-acetabular Impingement, Two-Dimensional Animation. Normal hip anatomy. The hip joint is a ball and socket joint composed of the acetabulum with its acetabular labrum, which is a soft tissue structure made of cartilage, which acts as a seal or gasket, keeping the joint fluid within the hip joint and leading to better lubrication and function. As the hip flexes up, under normal circumstances, there's not any pathological contact between the femoral neck and the acetabular labrum, allowing both to function normally. Under this arrangement, an average person walks many million cycles during a given year. Cam-type femoroacetabular impingement is associated with a non-spherical femoral head at the junction with the femoral neck. In this situation, the femoral head is enlarged adjacent to its femoral neck, leading to an area of what is called an aspherical femoral head, where the head is no longer in the shape of a sphere. This increased radius of curvature of the head is pathological and leads to injury to the hip joint during normal activities. The labrum is relatively well preserved with this type of femoroacetabular impingement. Common findings in CAM FAI include delamination or detachment of the cartilage of the acetabulum, which can ultimately lead to osteoarthritis. As the hip flexes up with the aspherical region, it pushes the labrum out of the way and causes a direct shearing injury to the articular cartilage of the acetabulum, which is the main load-bearing cartilage of the hip joint. This has a cumulative effect and initiates osteoarthritis in many young patients. Pincer-type femoroacetabular impingement is associated with prominence of the acetabular rim due to an excessively deep hip or a hip where the socket is turned backward, called acetabular retroversion. Under this situation, the acetabular rim extends further down and brings the acetabular labrum into the direct path of the femoral neck during routine activities. As the hip flexes up under this situation, the acetabular labrum is directly injured by the femoral neck, even if it has normal morphology and shape. Common findings in Pincer FAI include labral tears and cysts on the femoral neck called fibrocysts or herniation pits. Here we see the herniation pit, which is caused by direct compression of fluid into the neck and also a labrum tear. This has been a review of the two types of femoroacetabular impingement. CAM type, where there's enlargement of the femoral head, and pincer type, where there's an extension of the rim of the hip socket. Thank you.